Hi, my name is Dr. Rabanus and I'm a cosmetic dentist in San Francisco. Cosmetic dentistry is a very exciting field both for the dentist and for patients. For the dentist because he can be very creative and make a change in patients' lives, and patients because they want to change their lives and they want to look younger, fresher, and cosmetic dentistry is something that can help them to attain that goal. The most frequently tool used in cosmetic dentistry are porcelain veneers. I've received thousands of requests for information on my website asking many specific questions regarding porcelain veneers. The most frequent is how much tooth structure needs to be removed, and will I have pain, and how long will those veneers last? Those are all valid questions because tooth structure is the only human tissue that does not regenerate, and once it's gone, it will not come back. So I'm going to make a little drawing about a natural tooth and how it looks, and we'll go from there and explain a little bit about the logistics when considering placing veneers or preparing the teeth for veneers. So I'm going to draw a central incisor from the side. So this is about how a central incisor looks from this side. This would be the contact with the neighboring tooth. This is where the teeth contact. It usually looks a little bit more like a contact area because it's all filled with saliva, but really there's only a certain contact area to the neighboring tooth. And up here we would have the gums. Before I go into the preparation design for veneers, I have to talk about the anatomy of teeth and how nature designs them. There are three principal layers that you find in any tooth. On the outside, you have enamel. In the center or under the enamel, you have a structure that is called dentin. And right in the middle of the tooth, down the root to the nerve canal, you have what is called a pulp. So the enamel is the layer that protects the tooth, and it's the hardest tissue in the human body. It has different thicknesses depending on where you are at each individual tooth. Usually you have a thickness of about 0.3 to 0.5 millimeter up here, so you go like this. And then you usually have a thickness of about 0.8 to 0.9 millimeter in this area. And usually you have about 1.5 to 2 millimeter in this area. Now, there are many different ways to design a porcelain veneer. There is an ideal scene, and there are textbook parameters that are given to a dental student or to a general dentist who wants to advance to be a cosmetic dentist. But teeth are never in the ideal position, so I have to explain a little bit what the parameters are that determine where and how much teeth need to be reduced in order to create a receptacle for porcelain veneers. Ideal would be if I could just reduce the tooth here by 0.3 millimeter. To stay in enamel, and in this area to reduce it by about 0.5 millimeter, and in this area probably to just reduce it by 1 millimeter. This has its limits. While it's good for the tooth and you still preserve like a certain thickness of the enamel, there are limitations for those veneers. Times have changed. In the past, like 20 years ago, veneers needed to be bonded to enamel because there were no chemicals available that would allow a dentist to bond veneers to the underlying structure, which is called dentin. So this here is dentin. And this out here is enamel. And then we have a structure that's here, that goes all the way down the root, which is called the pulp. Okay. Now in the past, about 15 to 20 years ago, veneers had to be placed on top of an enamel layer to allow for a strong bonding between the porcelain and the tooth. Nowadays we have chemicals available that allow the bonding of veneers to dentin. While it is not quite as strong as a bond to enamel, it is often necessary. And there are several reasons for this. Number one, patients come to me who have dark teeth. If you place the veneer that only has 0.3 millimeter and 0.5 millimeter in this area, it will not be thick enough to shield away or blend away the darkness of the teeth under there, unless it's done very opaque, and then you would get something like a denture smile, like a white porcelain smile that doesn't look natural at all. Another reason why teeth have to be repaired more than others is they're crowded, they're misaligned, they're misshaped, they already have restorations, fillings, or other materials or caries associated with them, all of which needs to be removed. And for that reason, a veneer already will have, by definition, a higher thickness in those areas. So what is the perfect thickness for any veneer? It's really unpredictable. It depends on each individual patient. Not every patient is the same. Every patient is different. And every patient has different requirements. And a dentist needs to understand the logistics and the parameters that dictate the thickness of a veneer. Most of my patients that come into my office, they have dark teeth and want them to look lighter. Most of them are in middle age and they're in their 40s and higher. They want to have younger looking teeth. Most of them have chipped teeth. They have ground their teeth down to a certain level, partially because they have a parafunction which is not healthy, or because they just have used their teeth due to decades of using them. Then I have patients who have crowded teeth, where teeth are misaligned, so certain areas are sticking out more than others. And I have patients that have spaces between their teeth. And that requires a certain preparation design of the teeth. Now all this I cannot draw on this particular picture, but I just want to make one principle clear for a very sound veneer preparation. Now,